On to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Premier. Nova Scotians know the healthcare system is in a crisis. Waiting lists that stretch actually into years, hallway medicine, and a doctor shortage, and we could go on and on. People didn't think it could get any worse, Mr. Speaker, but they are wrong. Many Nova Scotians learned within the last 24 hours that they may soon experience the chaos that a strike by 6,500 healthcare workers will bring. How long will the Premier allow the threat of chaos and uncertainty to hang over the heads of Nova Scotians who want, who need, and who deserve reliable health care?
The Honourable Premier.
Mr. Speaker, I look forward to continuing the great relationship I've developed with our public sector unions to make sure that we can live within our means and deliver the great services Nova Scotians can expect. And the healthcare workers that I know will continue to work with us to make sure that we deliver those services.
The Honourable Leader of the Official Opposition.
Well, that was such a short answer for such a crisis that we're going to be in.
Really long, yes.
No one will disagree, Mr. Speaker, that the health care is absolutely an essential service, and in many cases, accessing health care services in a timely manner is literally a matter of life and death in this province. For Nova Scotians awaiting surgery or with complicated health conditions, the possibility of a strike will bring concern and anxiety. Will the Premier table the details of the Essential Services Health Care Plan today so that Nova Scotians can understand how a potential strike will impact them further in this province?
The Honourable Premier.
Thank you, Mr. Speaker. As the Honourable Member would know, we were the first government in the history of this province to actually call health care an essential service. Mr. Speaker, when we put a bill before this House, the Honourable Member voted against it, including the entire party, Mr. Speaker. And the four bargaining units in health care assured all members of this House they could bring us to essential service legislation, and they don't have the right to strike, quite frankly, until they deliver it. Unfortunately, if we had left it the way the Honourable Member would have wanted it, this health care would be in crisis right now with stable providing systems for Nova Scotians.
The Honourable Leader of the Official Opposition on her final supplementary.
Thank you, Mr. Speaker. The difference, though, between that side and this side is that we actually have a plan to fix it. So the Health Care Council of Unions are complaining that the government is using stall tactics to get its way at the bargaining table. The only problem is, Mr. Speaker, they are gambling with the lives of Nova Scotians. Gambling with the lives of Nova Scotians. Sick Nova Scotians should not be used as bargaining chips in this high-stake game. It has to stop, Mr. Speaker. So can the Premier guarantee that Nova Scotians who need care will get it, even in the event of a strike?
The Honourable Premier.
Mr. Speaker, the honourable members in the opposition's plan for health care is fear-mongering, Mr. Speaker. The fact of the matter is, we delivered in front of this House.
Order, please. The Honourable Premier.
Mr. Speaker, the fact of the matter is, we delivered essential service legislation to this House. The honourable member voted against it, Mr. Speaker. She voted against it along with every member of her caucus, said we do not believe health care is an essential service. Year after year, decade after decade, they allow health care patients in this province to be used as political pawns in bargaining. We ended that practice, and we expect them to deliver essential service, and we're not. We expect them to ensure they're in their place of work.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, in the summer of 2017, David Doucette didn't have a family doctor and was feeling too sick to go to a walk-in clinic, so he went to the emergency room for help. And on his fourth visit there, Mr. Doucette was then at death's door, had no choice but to leave the emergency room and go to a mall parking lot and call an ambulance there in order to receive medical attention from paramedics. And that night, it was discovered that Mr. Doucette had stage 4 non-Hodgkin's lymphoma, and his hematologist said that when he was diagnosed, he was the sickest person she had ever seen survive. Now, Mr. Doucette has asked a question, Mr. Speaker, that deserves to be posed in this legislature and deserves to be put to the Premier. And Mr. Doucette's question, which I'm quoting exactly, is this. What is wrong with the government?
I'd like to remind the honourable member the rules of question period indicate that you're not allowed to ask a question directly from a constituent. So you can ask your question to the Premier. The Honourable Leader of the New Democratic Party.
Is your ruling affected by the fact that Mr. Doucette is not a constituent? Okay.
You're able to ask the question from one member to another, not directly on behalf of any constituent.
In fact, as it turns out, Mr. Speaker, Mr. Doucette's question is a question that I and others in our party have asked many, many times, and so I will put it directly. The question is, what is wrong with the government of Nova Scotia that we can't get some doctors in here?
The Honourable Premier.
Thank you, Mr. Speaker. And again, I too read the article, Mr. Speaker, and the experience that Mr. Doucette had is unacceptable, Mr. Speaker, at any time in our province that no patient should end up being in a park lot calling ambulance and find out that the level of illness that Mr. Doucette has been under. Mr. Speaker, I want to remind the honourable member of the budget that we introduced today, or sorry, a few days ago. The agreement we have with Doctors of Nova Scotia is to deal with the very issue the honourable member is referring to ensure that we've increased the benefits around family practice docs, making sure that we have reducing the 811 list, continuing to work in a collaborative way with our healthcare providers to ensure that a healthcare team is available to all Nova Scotians.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, we have got over 100,000 people without a doctor. We have got emergency rooms that are plugged and stogged or closed. We've got seniors all over the province waiting for placement in nursing homes. And now we learn that 6,500 frontline healthcare workers in Nova Scotia are moving to a strike vote. Mr. Speaker, this move to a strike vote signifies that there are an awful lot of frontline healthcare workers in Nova Scotia who, too, have lost confidence in this government's capacity to be effective on healthcare. So I want to ask the Premier, is this not a great concern to him, and what does he plan to do about it?
The Honourable Premier.
Thank you, Mr. Speaker. I'm going to continue to work with our partners across the province to ensure that we can provide healthcare services in communities from one end of the province to the other. As the honourable member would know, part of the collective bargaining process is those healthcare workers have the right to take the strike vote if they wish. As he would know, his party voted against an essential service piece of legislation, which the four major healthcare unions assured all Nova Scotians they would put together a plan around essential services. Mr. Speaker, the happy approved. We're waiting and welcoming, looking forward to that. But we're continuing to look and make sure that we get a deal at the bargaining table as we have with other collective agreements.
The Honourable Leader of the New Democratic Party on his final supplementary.
Mr. Speaker, this move to a strike vote comes at a very significant moment. Nurses are speaking about constantly working short across the province. CCAs are speaking about their outrage at the nursing home funding cuts. Doctors are taking the government to court, and now 6,500 healthcare workers are throwing up their hands. And so I want to ask the Premier, does he not see that his failure to listen to and to work with and to adequately respect the people who actually deliver health care in Nova Scotia is contributing to exacerbating, deepening, worsening the health care crisis in our province?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Mr. Speaker, we all know, not only in this province, across the country, there's been an HR shortage issue in many places. The fact of the matter is, in this province, successive governments in this province ignored the issue. We came to government in 2013. We're continuing to lay out strategies on how we deal with it. We're seeing 100 new doctors that came into the province last year. In this recent budget, we believe we will get to the 6-month national wait when it comes to orthopedic surgeries. The honourable member would know when they left government, there was about 2,400 people long-term care wait list. That's been cut by 53%. We know there's more work to do. Mr. Speaker, we're going to continue to work with our partners to continue to make sure that we continue to reduce those wait lists, provide the services Nova Scotians expect.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. I'm absolutely wondering if this government took any practical, expert advice on the legalization of cannabis. After ignoring the federal task force advice on co-location, it seems that this government is also ignoring the advice of the Nova Scotia Liquor Corporation. A Freedom of Information request confirmed that co-locating alcohol and cannabis would increase the already significant legalization costs to Nova Scotia taxpayers. The NSLC's advice stressed that standalone stores would ensure a standard, easily duplicated store design, keeping costs down and reducing delays. Co-location means the Nova Scotia Liquor Commission will have to keep stores open during construction, and I'll table that. So why did the Premier choose the option that creates the greatest expense for Nova Scotia taxpayers?
The Honourable Premier.
Mr. Speaker, the whole entire premise of her question is absolutely wrong, Mr. Speaker. If you go back and look at where these are located, they are already the stores that have where they had the U-vent, where they were actually making wine in those stores. We removed that service. It's gone out in the private sector. The separate rooms are made available. Young kids will not be allowed into those rooms. It's actually the lowest cost in terms of capital costs for the taxpayers of Nova Scotia. So we continue to move forward. The fact of the matter is they'll be able to order that online across the province as well. We're going to continue to monitor as we continue to roll out this product, and I share this with the honourable members. I said to many Nova Scotians, next year edibles will become part of this conversation. We need to make sure that the distribution network reflects the desire and demand of Nova Scotians.
The Honourable Leader of the Official Opposition.
May not even be legalized until next year. The advice that this government received on co-location was not just hypothetical or academic, it was from practical experience. And in that I tabled that it says, according to one of the resources referred in its deliberations, was an interview with Dr. Larry Walk, the Chief Medical Officer for Colorado, who had 3 years experience with this. When asked about selling cannabis in liquor stores, he said, I think it's a bad idea because the co-use of marijuana and liquor is simply bad. He went on to say, when consumed together, those effects are not just addictive, they are definitely increase somebody's use of both substances. Selling both from the same establishment is not just something we would support. So why would the Premier choose to ignore 3 years of practical experience and walk down the clearly dangerous road of co-locating?
The Honourable Premier.
Mr. Speaker, as a matter of fact, Mr. Speaker, we accepted the advice from Colorado where it said, Mr. Speaker, make sure you hold on to that distribution network in a tight way, because over a period of time, as you begin to understand you're selling this product, you can always let it out. Fact of the matter is, in Colorado, they can't control the distribution network, as the honourable member describes. She actually took the time to look what's happening in the Nova Scotia Liquor Corporations. You go in there in a separate room. They're co-located under the same roof, Mr. Speaker. Young people will not be allowed into those rooms. You'll purchase it inside of that room, and you'll walk out the same doors you do when you buy liquor in the province. The fact of the matter is, where there are separations under the same roof, we'll continue to ensure, we'll continue to monitor the distribution network of this province, and we're looking forward, Mr. Speaker. The fact of the matter is, the decisions that this government made, we will be ready on July 1st to ensure that we can distribute that through those locations we said we'll be ready.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health and Wellness. It was reported yesterday that one of the 4 orthopedic positions that the Health Minister announced in October has been filled. These positions were part of the government's plan to meet the national wait time standards for knee and hip replacements. Unfortunately, since we haven't been able to hire new surgeons, meeting that benchmark won't be in the cards this year. Mr. Speaker, will the Minister table the details of the recruitment plan for these much-needed specialists?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for raising the question, provide the opportunity for me to reiterate that in the fall when we announced this plan to move forward, the multi-year plan towards improving our orthopedic surgeries within the province of Nova Scotia, a plan that we worked together with our partner at the Nova Scotia Health Authority, as well as those healthcare professionals on the front line to develop this plan, the proposal to move forward. I want to remind the member, or advise the member and all members of the legislature, that in fact the plan did not require or call for any hires within the 17-18 fiscal year, Mr. Speaker, but in fact those hires are related to the proposed growth of this service into this coming fiscal year. So we're ahead of the game, Mr. Speaker. We have 3 out of the 8 positions filled already.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, I noticed that in this new provincial budget, there is an additional $8.8 million to do 350 more hip and knee surgeries and to hire more orthopedic surgeons. Now this, however, I'm scratching my head at, since the minister hasn't been able to recruit the surgeons that were budgeted for in September. Mr. Speaker, can the minister explain why Nova Scotians should believe that he'll be able to bring even more orthopedic surgeons to the province when he hasn't been able to follow through on the first batch yet?
The Honourable Minister of Health.
Mr. Speaker, thank you, and I'm happy to clarify the confusion for the member opposite. Mr. Speaker, as I just indicated, when the plan was first rolled out in the fall, Mr. Speaker, the plan for the 2017-2018, for about that 6-month period, really focused on a different approach for delivering services, the process by which services and the use of our operating rooms were provided, Mr. Speaker. That's how they were able to achieve over 400 additional surgeries already, Mr. Speaker, doing very well towards the target for this fiscal year. With the additional expansion with resources, anesthesiologists, as well as orthopedic surgeons and others to support the team, Mr. Speaker, we're going to be well on track to reach the target of additional 350 this coming year.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Finance. On March 2nd, my colleague from Pictou West asked the Premier about the potential cost to municipalities and police force as a result of the legalization of cannabis. On that day, the Premier committed to talking to municipalities about the best way to address the cost. The Premier made the following statement about the sale of cannabis. But let me be clear, there is no great revenue source here coming from this product. Well, Mr. Speaker, that was then and this is now. Just 3 short weeks later, the Minister of Finance delivered a budget that does, as a matter of fact, anticipate $20 million in profit from the sale of cannabis. My question to the minister is, when did the minister inform the Premier that the government expected $20 million in profit from the sale of cannabis?
The Honourable Minister of Finance.
Thank you, Mr. Speaker, and thank you for the question. I believe I mentioned this a couple of days ago, but in the budget that was presented, the estimate was for revenue. It was not for profit. I also indicated that the costs for the implementation of the federal legalization were unknown. We were working with the municipalities. Some of those will be borne by them through policing. There will be education, advertising, and all of those costs. They were not presented as a line item in the budget for costs. So just to be clear, the number that was there respecting cannabis was expected revenue based on what the NSLC will be purchasing. It was not profit.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. When you have $20 million in revenue and no expenses against it, the $20 million is profit. There is $20 million in profit in here. Also on March 2nd, the Premier went on to say, I have given my word to the Minister of Finance, don't spend any money that the opposition thinks is coming with this product because it just isn't there. Mr. Speaker, the Premier seemed to imply at that time that balancing the budget off the back of cannabis sales would be a dopey way to balance the budget. The Minister, to the credit, did not spend the $20 million because it makes up $20 million of the $29 million surplus. Given how quickly this $20 million appeared, just 3 short weeks, it's fair to say that the cannabis revenue could go up in smoke just as quickly as it appeared. It could be voted down in the Senate today, Mr. Speaker, after admitting that the cannabis revenue figure is just a number pulled out of the air. How confident can the minister be in the surplus that the government has booked? Thank you, Mr. Speaker.
The Honourable Minister of Finance.
Thank you, Mr. Speaker. Just to the last question, it certainly was not pulled out of the air. I indicated that it was based on what the NSLC believes that they need to have to purchase in order to meet the demand. We don't know what consumption is going to be. We don't know what that demand is going to be. But the NSLC recognized that they needed to put an amount on the quantity that they would have to be ready for July 1, and based on what they were recommending as the quantity they need, we based our projected revenue, not profit, on that.
The Honourable Member for Cape Breton Richmond.
Mr. Speaker, this government has decided to offer cannabis for sale in only 6 of 52 municipalities across this province. This leaves many people in rural Nova Scotia unable to easily access cannabis. For some residents in Cape Breton, the nearest physical sales location is over 90 minutes away. The solution for this, according to the government, is home delivery during online sales. Despite the recent announcement regarding rural internet, online purchasing is simply not in the foreseeable future for many residents in Nova Scotia, in rural Nova Scotia particularly. The question is, for Nova Scotians in rural areas without reliable internet access, how does the minister propose accessing cannabis? Or are these Nova Scotians simply not a concern for her?
The Honourable Minister of Finance.
Damn it.
Thank you. I would like to refer that question to the Minister of Justice.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I appreciate the question from my colleague, the Finance Minister. Mr. Speaker, we spoke about this extensively, both publicly and here in the House. And the mediums for access to cannabis are provincial in nature. The limit around numbers of retail stores is based on a business plan, Mr. Speaker, that anyone going into business would apply. What I want to share with my colleague is, yes, we recognize the limitations of high-speed internet, but my colleague would know that many Nova Scotians, in the absence of quality high-speed internet, often go to core communities in their day-to-day travels, and the ability to access cannabis online with home delivery, Mr. Speaker, is an element that Nova Scotians recognize and have asked for. The survey identified, Mr. Speaker, the need for that online preference. So, Mr. Speaker, cannabis will be available in Nova Scotians. Nova Scotia will be ready on July the 1st, and we look forward to the opportunity to communicate this further.
The Honourable Member for Cape Breton Richmond.
Mr. Speaker, my supplemental question will be again for the Minister of Justice. Most regular cannabis users in Nova Scotia, in rural Nova Scotia, will not drive 90 minutes for their pot. Nor will they wait for an online purchase to be delivered, and we're not going to look for smoke signals in the air either. They are most likely going to continue to access the black or grey markets for their cannabis. The NSLC business plan states that one of its priorities is to provide a safe supply of cannabis to Nova Scotians to help eliminate the illicit market. But this distribution model will only promote it in certain areas. Does the Minister, the Honourable Minister, anticipate that poor access to legal cannabis in rural Nova Scotia will continue to allow illegal sales to thrive?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I would say that the medium used and presented for Nova Scotians to access cannabis is a very reasonable medium. Mr. Speaker, I've said from day one, and it would be naive to think, as my colleague from Argyll-Barrington believes, it would be naive to think for any one of us in this House that tomorrow we are going to flip a switch and the illicit market is going to go away. We will transition, Mr. Speaker, from an illicit market to a legal recreational cannabis product of quality that provides safety to Nova Scotians.
The Honourable Member for Inverness.
Mr. Speaker, while normalizing it for youth. So, a question for the Minister of Response for the Residential Tenancies Act. Mr. Speaker, marijuana smoke is a very unique smell. About 300,000 Nova Scotians live in rental units. Many of those people live in apartment buildings. Those people may find it offensive. Certainly parents do not want their children exposed to it. I've heard from landlords and residents across the province. They're generally concerned about the negative impacts of consumption and the growing use of recreational marijuana will have on rental housing, especially the negative impact on multi-unit residential buildings. Will the minister allow landlords to open lease agreements to insert no cannabis smoking and cultivation clauses?
The Honourable Minister responsible for the Residential Tenancy Act.
Thank you, Mr. Speaker. I'd like to hand this question to the Minister of Justice, please.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I appreciate the question from my colleague. We have had extensive discussions around the elements of the Residential Tenancy Act and the concerns that have been advanced not only by landlords but by tenants as well. And the Residential Tenancy Act itself allows now for landlords to implement specific circumstances in leases where they can prevent elements within that rental environment. And the simple example that we use and identify, Mr. Speaker, is landlords have been able to identify smoke-free buildings which prevent tenants from smoking in apartments, and they've been able to identify the restrictions of pets. Mr. Speaker, the same circumstances apply in the Residential Tenancy Act for cannabis.
The Honourable Member for Inverness.
Mr. Speaker, one of the concerns raised is that they may expect landlords to enforce this through the Smoke-Free Places Act, which is very subjective and very difficult to do that when it comes to smoking. The other issue here is it's not just smoke that becomes an issue. Growing marijuana, cultivating it in apartments is an issue as well. Factors like temperature, humidity, lighting, and airflow are things that need to be adjusted to produce optimal growing conditions. Changing those things for optimal growing conditions may not be what's best for people who are breathing the air in the building. That will cause safety hazards and potential damage to people and to buildings. It puts tenants and mortgage holders at risk. How will the Minister ensure that tenants are safe in their homes and building owners' investments are protected?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. The agriculture harvesting of homegrown marijuana in a private residence will be the decision of private homeowners. In the rental environment that my colleague talks about, the same circumstances apply in the Residential Tenancy Act that would allow the landlord to restrict a tenant from growing within the property. The points that my colleague has shared are circumstances that we have discussed at length in the preparation of this particular piece of legislation, but I want to assure my colleague and all colleagues of this House and landlords across the province. I spoke yesterday with another colleague who asked similar questions, Mr. Speaker. The authority is already there within the Residential Tenancies Act.
The Honourable Member for Dartmouth South.
Thank you, Mr. Speaker. My question is for the Minister of Business. The $120 million investment to bring high-speed internet to our rural communities is so important. And with such large public investment, Nova Scotians want to be sure the benefits will remain in the hands of Nova Scotians. All of us have seen the high costs associated with P3 schools and the privatization of Nova Scotia Power. It's a discredited and expensive route, and we don't need to go down it again. The middle-mile internet infrastructure is an opportunity for us to get it right. Mr. Speaker, will the minister commit to ensuring that the public will own this infrastructure, since the public is paying for it?
The Honourable Minister of Business.
Thank you, Mr. Speaker, and I do thank the member for the question. I did listen intently to some of her comments around this topic at late debate and the fact that she alluded to the money leaving the province. Mr. Speaker, look, this is a reality that because of the challenges of broadband and getting the service to remote places in all areas of Nova Scotia, we've got to make investments. There isn't a private sector business model that would do that in all provinces, quite frankly, so we're making a very big investment on behalf of the people of Nova Scotia. Of course, by way of the Internet Trust and by way of the third-party corporation that will run these programs, we're going to invest this on behalf of Nova Scotians. So it will certainly be public infrastructure. Of course, there's a number of ways and requirements to make sure that accessibility and having access to this particular infrastructure is open to anyone who can access it to provide additional services. So it is a very good question. This is for Nova Scotians. It's not for the private sector to make profit. This is about getting broadband to our people. Thanks.
The Honourable Member for Dartmouth South.
Thank you, Mr. Speaker. With respect, if it's not a cooperative local enterprise, the profits will not remain with Nova Scotians. Mr. Speaker, I hope this government, if they need an example of this, will listen to the inspiring and clear message coming from the municipality of Annapolis. When they saw market failure in rural internet, they took matters into their own hands. In Lawrencetown, community members got together and formed a cooperative. Those volunteers worked with the municipality to build their own last-mile infrastructure, and now the village owns the infrastructure and the cooperative runs the service. The profits and control stay in the community, and I'll table that. In a news clip, residents said they were getting twice the speed for almost half the price. And what is most important, in the words of one resident, Diana Ackroyd, is, "It's ours, it belongs to our community," and I'll table that. Mr. Speaker, I'll ask again, will the minister commit that the province's spending will support community assets and community control, or at least look into it before we commit to a private partner?
The Honourable Minister of Business.
Thank you, Mr. Speaker. Simply put, philosophically here, we're making a historic investment in broadband. I don't feel that we're giving it away to corporations. I don't think that we're doing anything other than the right. Sorry? Just do it right. So of course the opposition wants us to do it right, Mr. Speaker. But believe it or not, we're intended to do it right. We are going to do it right. Right. Yeah. Yes. Thanks for the lesson. So we'll make sure that we learn from their mistakes, Mr. Speaker, and we get it right. Look, Mr. Speaker, this is a major problem. There's no benefit for us to do anything other than get this investment in the hands of the communities. The municipalities are going to play a critical role here, Mr. Speaker. We need them to tell us what projects they require in the communities on the ground. That's exactly what we're going to do. This money, $120 million, and a whole lot more to get to that $500 million finish line, it's for Nova Scotians. They're going to tell us how we spend it. We're going to get them broadband. Thank you very much.
The Honourable House Leader for the Official Opposition.
Thank you very much. My question is to the Minister responsible for the NSLC. According to a Q&A produced by the NSLC, there is no prohibition on selling recreational cannabis to a customer who is under the influence of cannabis, and I'll table that. And by contrast, NSLC employees are not allowed to legally sell beverage alcohol to a customer who is under the influence. And according to the American Addiction Center, some of the common physical side effects associated with marijuana are poor muscle and limb coordination, delayed reaction times and abilities, and a distorted sense of perception. My question is two-parted. Is it accurate that the NSLC employees will be allowed to sell cannabis to customers who are clearly under the influence? And if so, how will they know if a customer is impaired by cannabis, by alcohol, or some other substance?
The Honourable Minister of Finance.
Thank you, Mr. Speaker, and I know that the member is anxious to see what's in the legislation, but one of the things that I think we all recognize is that there will have to be some education, some training, some learning that will take place by all of the employees at NSLC so they can be sure that they are protecting the youth and those who may be under the influence and all of those other concerns, because they will be the ones who are in the front line with the customer.
The Honourable House Leader for the Official Opposition.
The NSLC's Q&A concedes that they've heard from employees that selling and handling cannabis is a sensitive issue. People who sign on a job to sell beverage alcohol had no idea that they would be required to handle and sell cannabis, a substance that's been illegal in Canada for almost 100 years. And now they must ponder whether or not they'll be liable should an incident happen after they sold cannabis to a person that's already under the influence. The Q&A says if employees don't like it, they will have to find work somewhere else. My question to the minister is the government forcing NSLC employees to sell pot or quit?
The Honourable Minister of Finance.
Thank you, Mr. Speaker. As we would expect and as we want and as we have asked NSLC and any employer to make sure that they work with their employees and they have a relationship there between employer and employee, and if there's additional training that's required, we will make sure and the employer will make sure that that employee has that training.
The Honourable Member for Sackville-Beaverbank.
Yeah, thank you, Mr. Speaker. My question as well is to the Minister responsible for Nova Scotia Liquor Corporation. We all know legal sale of cannabis coming, obviously, by questions asked here today. There's a lot we just don't know about this product. It's my hope and my expectation that a full education program would precede the start of the sale, but obviously we're running out of time. There's many Nova Scotians who are going to be starting from day one at zero when it comes to cannabis. They don't know the amounts, the strengths. There's a lot of questions people don't understand. People know that they can go to the Nova Scotia Liquor Commission, they can get a beer or light beer, they understand they can get 750 mils of spirits or 1.4 litres of spirits. Can the minister provide me some details about the products that the Nova Scotia Liquor Corporation will offer, the THC content and the package sizes?
The Honourable Minister of Finance.
Thank you, Mr. Speaker. And the question the member raises is a good question. It takes me back to the answer I just gave, that there will be an education component for the employees, there will be an education component for Nova Scotians, and we need to recognize, and we will recognize, that once people start selling cannabis, they need to be knowledgeable about the product that they're selling, and they will have to live within the guidelines that will be in the legislation.
The Honourable Member for Sackville-Beaverbank.
Well, you know, thank you, Mr. Speaker, and I appreciate that comment because it kind of leads into my next question, Mr. Speaker. You know, customers are going to be relying on Nova Scotia Liquor employees to help them with product choices. They are going to go to the Nova Scotia Liquor Commission. They do it now. They ask an employee, you know, or they expect to be able to ask an employee for recommendations on a good type of wine or some type of a product, and often they ask those employees. They provide an opinion based on personal experiences, having tried the product themselves. So my question, Mr. Speaker, is does the minister expect employees of the Nova Scotia Liquor Commission who are selling cannabis, is there an expectation that they've actually tried the products in order to properly advise the customers?
The Honourable Minister of Finance.
You know, Mr. Speaker, people are getting a little lighthearted and maybe a little lightheaded, but anyway, I think it's, I'm serious too. I think we have a steep learning curve, both as Nova Scotians, both whether we're a consumer, whether we're not a consumer. I think we have to recognize that there's a lot of education that has to take place. To the member's question, the employees, those who are purchasing, the general public, for many, it's a steep learning curve, and there's a lot of danger, there's a lot of risk. We want to make sure, and we've said from the get-go, that our position will be to ensure the safety of youth and children as we move down this road. It is a new territory for all of us, and that's why it's important that those people who are handling the product are very well aware of what they're handling, the marking on the product to make sure it clearly identifies the content. And thank you, Mr. Speaker.
The Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker. My question is to the Minister of Municipal Affairs. The federal government is legalizing recreational cannabis and the provincial government is distributing it. But it's the local governments and police forces who will be the most impacted by legalization. Municipalities will have to mobilize so that the residents remain safe. They will bear most of the responsibility to eliminate the illicit market and ensure that residents have the best tools available to make the decisions that don't adversely affect their physical and mental health. Municipalities like the County of Victoria are anticipating cannabis legislation will have a significant financial implications for policing, by law enforcement, and more. My question to the Minister is, can municipalities like the County of Victoria count on the province to help with additional funding for policing and other costs associated with legal pot, or will this government leave cash-strapped municipalities to find extra money in their own budgets?
The Honourable Minister of Municipal Affairs.
Yeah, thank you, Mr. Speaker, and thank the Honourable Member for the question. Throughout this process, we've ensured that the voices of municipalities have been heard. One of the first steps that I took is I asked staff to go out and do public consultation in conjunction with the Department of Justice, which many participants, whether they were elected municipal officials, staff, or law enforcement across Nova Scotia, go to various sessions held from Cape Breton to Yarmouth. We keep a close connection with the Department of Justice, and we're constantly advocating for more educational supports and equipment supports to support our local law enforcement and to support local municipalities. I can assure the member that as we move towards this date, the voices of municipalities will continue to be heard and advocated through the process.
The Honourable the Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker, and I thank the Minister for that. The federal and provincial governments have repeatedly stated that municipal governments are key partners in the new cannabis regime. Many municipalities are very fearful about how the change is going to affect their already stretched municipal budgets. Municipalities are concerned that by-law enforcement be used to enforce provincial and federal provisions relating to home cultivation, They're concerned they'll have no say where pot can be consumed, and they wonder what tools they will have to impose penalties and fines for illegal, unlicensed distribution activity. So my question to the Minister, what steps is the Minister taking to address municipal concerns like the ones I've just mentioned?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. And I thank the member for the question. Most importantly, through this process, we've ensured that at every avenue that the voices of municipalities were heard as we move towards legalization. And working with the Department of Justice, we're applying for funding for more educational programs for our municipalities, for more equipment for our law enforcement, and for more tools that municipalities can use. As I said, we will continue to ensure that the voices of municipalities are heard through this process. We've heard their concerns, and I've assured them as the Minister for them that we'll do whatever we can to work with our partners to ensure that whatever supports we can provide to them, we will. Thank you.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Labour. This morning I heard the stories of former Duncan mine workers, and they made me frustrated and afraid. These workers are sounding the alarm about sparks flying without methane detectors, ceilings caving in and spraying concrete without masks. According to these mine workers, productivity is being put before safety, and I'll table that. These descriptions are similar to the conditions that resulted in Westray, and I'm scared that this government's response so far has been superficial. Mr. Speaker, at Westray, it took just one spark. That's all it was. My question to the Minister, will you commit to immediately and thoroughly investigating these complaints and make sure there are real consequences for any violations?
The Honourable Minister of Labour.
Mr. Speaker, I'd like to thank the member for the question. This is a very important question. The safety at Duncan Mine and every other workplace in Nova Scotia is the utmost importance. There is no leeway when it comes to safety. I can assure the honourable member, I can assure every member in this House and every member in Nova Scotia that all of the issues that have been brought up have already been looked at, and they've already been addressed with the company. The company is playing by the rules, Mr. Speaker. We've had a great working relationship with them. We do constant site visits, both announced and unannounced, and every time anything's come up, we've actually had the company respond. Mr. Speaker, I'd also like to add to the House that one time on a technicality, when the company had a generator that had not been inspected, we shut the mine down. So I want you to know how important safety is. We shut the mine down over a technicality of a generator that hadn't been inspected. The inspection was done, the generator was fine, and we knew there was probably no reason to shut the mine down, but that's how safe this mine is. Thank you, Mr. Speaker.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, this is a company that promised good jobs for our community. But within months of opening, it had dozens of safety violations, and within a year, it had cut 1/3 of its jobs. Now we hear the violations are continuing, and there is a culture of fear in the mine against speaking up about safety, or a union for that matter. In Cape Breton, we know from a long history that there is only one thing that makes the company listen to its workers, and that's a union. Now we hear management have told the workers that if they try to start a union, they'll just fire everybody and hire new workers. That's illegal and disgraceful. Mr. Speaker, will the minister commit to provide mine workers automatic protection in a union?
The Honourable Minister of Labour.
Mr. Speaker, to all the mine workers that are at Duncan Mine and any other workplace in the province, if they feel they're in an unsafe work environment, I advise them to call 1-800-9-LABOR. It's an anonymous tip. It's an anonymous tip line in the Department of Labour. We will send out our occupation health and safety inspectors immediately. Again, Mr. Speaker, I would like to reiterate to all the workers at the mine, we investigate every complaint that comes in. We do both announced and unannounced investigations. The mine is safe, Mr. Speaker, but we also have to remember that this is a very large industrial site. We have dedicated staff to the mine, and it is a dangerous work environment, but what we do is we mitigate that risk, and the mine is a partner with us, and we have seen very good results with the company and with the workers. Thank you, Mr. Speaker.
The Honourable Member for Cumberland North.
Thank you, Mr. Speaker. This question is to the Minister of Health and Wellness. Last year, the Canadian Centre on Substance Abuse and Addiction conducted a survey that confirmed our youth have a poor sense of the negative effects of cannabis use, and I'll table that document. The survey found that participants participants underestimated harms associated with cannabis use, such as driving while impaired, impact on brain development, risk for addiction, and other mental and physical consequences. Some respondents described friends who were frequent cannabis users as prone to anxiety, edginess, and aggressiveness after periods of not using cannabis. Mr. Speaker, my question to the Minister of Health is what specific funding is the government allocating to enhance mental health and addiction supports, specifically for those with dependency on cannabis?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member knows, we're investing and have invested in the last number of budgets as one of our priority areas around mental health and addictions. We're doing a lot of work, Mr. Speaker, both as a department with our partners in the Nova Scotia Health Authority and the IWK, as well as community partners to provide supports and services to people who do have mental health and or addiction challenges. So, Mr. Speaker, we continue to invest into these areas, Mr. Speaker, not just if that addiction or concern is related to cannabis, but for many other substances as well.
The Honourable Member for Cumberland North.
Thank you, Mr. Speaker. In the budget tabled this week, supports for cannabis-related mental health and addiction issues were not on the minds of the government. The word cannabis, in fact, only appears in the budget in relation to how much money the government claims it will make and how much cannabis the NSLC claims it will sell. The Department of Health and Wellness doesn't seem concerned about the effects cannabis will have on mental health services. In fact, they could only find a couple of million to kick towards a $300 million mental health care budget. Perhaps the minister is hoping that, so much like the rest of the healthcare system, the potential threat will simply sort itself out if we ignore it. If this government the question is, if this government is indeed prioritizing mental health and addiction support strategy around cannabis, where is it found in the 1% increase in mental health supports?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As I've mentioned earlier, the investments around mental health and addiction services and support are a combination of multiple factors. Some, of course, are increased investments, financial investments. Some of it relates to advancing changes in practice, Mr. Speaker, based upon the evidence and what's been learned about the delivery of services, whether they be for mental health services and addiction services, Mr. Speaker. The evolving evidence, best practices that we're learning from the clinicians on the front line is that community-based supports for people with these types of conditions is actually the best way to move forward. Mr. Speaker, although I appreciate the concerns the members bring forward around cannabis with this as an emerging recreational legal product, Mr. Speaker, I don't want the member to forget about the opioid deaths that are taking place in this province, Mr. Speaker, and our significant commitment under the opioid framework to move forward and support and save lives from one end of this province to another.
The Honourable Member for Kings North.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, Dr. Phil Thibault is a psychiatrist, the Dalhousie Chair in Psychotic Disorders, and Director of the Nova Scotia Early Psychosis Program. He has authored a number of papers linking the use of cannabis with the onset of schizophrenia in young adults and youth under the age of 25, and I'll table them. One from the Chronicle of Neurology and Psychiatry titled The Brains of Youth Harmed by Cannabis, another titled Cannabis in the Maturing Brain, Role in Psychosis Development, authored by Crocker and Thibault. I'll table those. My question for the Minister is this. Does this government agree with Dr. Thibault that the use of cannabis can have a devastating impact on the mental health of young Nova Scotians?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for bringing this question to the floor of the legislature. Indeed, Mr. Speaker, we do know that the situation before us, legislation that we're expecting during this legislative session to be tabled around the provincial response to cannabis legalization, we have to recognize that this is a response, Mr. Speaker, to changes being made at the federal level in the legalization of this market, Mr. Speaker. It is, as my colleague, the Minister of Finance, stated earlier, really a new territory for all of us in this province and across the country. And indeed, we're trying to balance a number of factors, making the best decisions we can on behalf of all Nova Scotians for both their safety as well as their access to meet the obligations that we do have.
The Honourable Member for Kings North.
thank the minister for that answer. Mr. Speaker, when this government tabled its budget this week, it claimed that sales of cannabis would increase revenues for the province. So my question for the Minister of Health is, has his department calculated how much cannabis use will actually cost the healthcare system, and is he prepared to put additional resources into mental health services to accommodate that?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank, again, the member for the question. I think we've demonstrated, Mr. Speaker, that mental health services are a very important priority for this government. It's why we continue to increase our investments, Mr. Speaker, upwards of about $300 million going towards mental health and addiction services throughout this province and in the budget, Mr. Speaker. That's a significant investment, and we know it's not about the money, but it's about where that money goes and what it enables us to do, Mr. Speaker. We provide those resources through clinicians, the Nova Scotia Health Authority and the IWK, but also with our community partners, Mr. Speaker. We've shown, I think, Mr. Speaker, in the past and in this budget that we're certainly committed and dedicated to providing additional financial resources as needed to support mental health needs and addictions in this province.
Thank you very much. The Honourable Member for Northside, Westmount.
Thank you, Mr. Speaker.
Order, please. Good to see you, though. That concludes the time allotted for oral questions put by members to ministers. The Honourable